back to The Wellness Effect. Don't forget to subscribe and hit that notification bell so you don't miss out on any of our episodes. In this episode, we're joined by Dr. Jaytesh Pillay, an orthopedic and spinal surgeon, as we explore spinal health and more specifically, spinal deformities and surgeries. Welcome, Dr. Pillay.
Thank you for having me.
Could you explain to us what spinal deformities are and what common spinal deformities you encounter in your practice?
Sure. So a spinal deformity basically means there is a curve in the spine. It can be a front to back curve, it can be a side to side curve, or even a three-dimensional curve. The most common types, actually there are two big groups.
Yes.
The first group is that what you get in the older patients, and this we refer to as a degenerative scoliosis. So as we're getting older, the muscles get weaker, the bones get weaker, and we develop curves in our spine. The second group is that which we find most commonly in children, and that's a little bit more complex because you get more groups within the groups there. So the common types you find there are the first group, which we call congenital scoliosis, which means the children are born with that kind of scoliosis, and there is something wrong in their bones. This is commonly associated with some sort of syndrome. And then the most common group we get, which we call adolescent idiopathic scoliosis. This is the one that I see most common, is where children develop a scoliosis or a curve in their spine, a deformity in their spine as they're reaching into their teenage years. And in fact, we don't know the real cause of the scoliosis. So this can be genetic, there can be abnormal growth, but we don't know the most common cause. But this is the most common one we see.
So what are some common signs that individuals could look at for spinal deformities?
Okay, so this is an interesting one because as we get older, the most common sign is, of course, pain. Patients can experience back pain and they're going to come to me with pain in the back. Okay, but the younger children don't experience pain due to spinal deformities as much as we as adults experience pain. So usually the parents will come to me and say, they found as they were changing the child's shirt or dressing them in the morning, they found there's something wrong with their back. And they usually say they find a hump on the back. So some of the most common things that parents can look out for is, for example, imbalances in the shoulder. One shoulder blade is higher than the other shoulder. The pelvis is more tilted than the other side, or children walk with a small limp. And in fact, in the olden days, we used to screen for scoliosis as we did what we call a forward bending test. So children would bend forward and touch their toes, and then you can see a hump on their back. And this is what we call the bending test, and that's a good way to screen for scoliosis.
So what are some of the most common myths that you hear about spinal surgeries from your patients?
So the most common thing that I hear is, after this spinal surgery, I won't be able to walk again, or I'll be paralyzed, or I'll be in a wheelchair, which is of course not true. The truth is that spinal surgery, if done for the correct reason and done correctly, will lead to a better life after the surgery. You should be able to live a normal, active, healthy lifestyle after a good spinal surgery.
And what are some of the risks and downsides that patients should consider when contemplating having, spinal surgery?
As with any surgery, whether it's a small surgery or a big surgery, there are always risks involved. Spinal surgery is high risk because we're working near the nerves, we're working near the spinal cord, we're working with near the vessels. There's always a high risk involved in spinal surgery. However, these days, we've got such good emerging technologies, such as we've got nerve monitoring technologies, we've got minimally invasive spine surgeries, we've got robotic spine surgeries, we've got endoscopic spine surgeries, which means that the risks during spine surgeries is much, much lower than it was 10, even 15, even 5 years ago.
Doc, how do we prevent back problems and scoliosis as we get older?
The best way to reduce the risk of scoliosis or deformities or back problems in general as we get older is to maintain a good back health as we're younger. Okay, so some of those things involving doing things like regular exercise, biokinetics always helps. That's core strengthening. We can do exercises like Pilates, yoga. Other important things is correct posture, correct chairs while working, not working from the laptop while we're sitting in our beds, those kind of things. All things relating to spine health can reduce the risk later on in life of developing back problems.
So, Doc, if you suspect that you've got a spinal deformity or an injury, who should you go to first? Is it your general practitioner, an orthopedic surgeon?
I always advise to go to a general practitioner first. They are well equipped in screening and looking out and deciding if there is a deformity. They will, of course, do some investigations. Usually, we do some x rays to see if there's anything abnormal. And then, if they do suspect something or if they do find something, then they will refer you to appropriate orthopedic surgeon or spinal surgeon who can help um, with the scoliosis or the deformity or whatever it is they find.
Thank you, Dr. Pillay, for an engaging and insightful conversation.
Thank you for having me.
And thank you for watching. Remember to subscribe and hit that notification bell so you can catch every episode of The Wellness Effect. See you next time.
BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.